Bismillahirrahmanirrahim. This is Dr. Iram from the Happy Dentist channel, which is aimed to help students understand and learn dentistry in an easy way. Today, the topic of discussion is RCT, root canal treatment. In dentistry, root canal is a treatment to repair and save a badly damaged or infected tooth instead of removing it. As we all know that tooth has three main parts that are enamel, dentine and pulp. In cases where caries affect enamel or dentine, the filling or restorative procedure could be done. But in cases where pulp is involved, RCT could be done. The term RCT or the root canal treatment itself indicates that it's basically the cleaning of the root canals that contains the radicular pulp. So it's basically a procedure where we will work inside the canals and will clean it, and then finally will fill it with obturating or filling material in order to save the tooth. For RCT to be performed, a dentist needs to access or a path gain entry into the nerve space of the tooth. Making this opening is called access cavity. There are three steps to perform RCT. The first one is access cavity preparation. In simple words, it is the first step of the RCT in order to gain a straight path from the occlusal table, lingual or parietal aspect for the anterior teeth or posterior teeth to the canal orifice and apex. The second step of RCT is working lead determination and canal preparation. In this step, we record lengths of the canals by keeping files in it and taking radiograph with it. This measurement usually shows us the precise length or space in which we will carry out the procedure and do filing. The final step of RCT root canal treatment is obturation, which in simple words mean that we fill the cleaned root canals with obturating or filling material. So the basic aim of this step is to seal the orifice or the apex of the tooth. Now I will discuss the very first step of RCT, that is access cavity, in detail. What is access cavity? What it means? What does the access mean? Just by its title, can you guess what it means? Access means a path or opportunity to approach or enter a place. For the procedure of RCT, it means to gain a straight path from the occlusal table, lingual or palatal aspect to the canal orifice and apex of the roots of the tooth. You can see in this animated picture of the tooth the entry of the access cavity and its ending point. That is from the occlusal level of the tooth to the apex of the tooth. What are the aims of access cavity? The basic aim of access cavity preparation is visualization and physical access for the instruments and the materials used during RCT. Access cavity is prepared in three steps. That is the number one, the penetration phase, that is outline form, where we fill dip or drop with the round rod into the chamber, or the convenience form. In this phase, the cavity is enlarged by using pulling out or scoop out motions of the burr. The third phase is finishing and flaring phase, in which we remove the remaining carious dentine and restorations by using a tapering fishing burr that is used to create divergent walls that make easy access to the orifice and to the root canals and instrumentation. Here in the first picture you can see a normal intact tooth. In second picture, a round burr is used to expose the pulp chamber. A drop could be felt at the moment of exposure of the pulp chamber. In third picture, pulp chamber is opened. In picture entitled D and E, a tapered fissure burr is used to make the walls divergent. The last picture is the final presentation of prepared access cavity. Now comes the access cavity shapes of mandibular and maxillary teeth. Axis cavity of incisors, canines, and premolars are oval in shape, while for molars it's trapezoidal or rhomboid in shape. Incisors, canines, and premolars have single canals, while for molar it has some variations. That is, for first molar there are 3 or 4 canals, and for 7, that is second premolar, it also has 3 to 4 canals. Now comes the maxillary teeth. The axis cavity for central incisor and lateral incisors are rounded, triangular in shape, while for canines, premolars, it's oval in shape. For upper molar, first molar, and second molar, it's rhomboidal in shape. You can see that the central incisors, lateral incisors, and canines and second premolar have single canal, while for upper first premolar it has 2 canals. For upper first molar there are 4 canals, and for upper 3 there are also 3 canals. For the upper one molar, they are known as mesiobuccal, distobuccal, palatal, and mesiobuccal 2 canals. So these were the axis cavities for the mandibular and maxillary teeth. One thing should be kept in mind that these images show the axis cavity shapes of ideal non-cavity caries tooth. But in clinical scenario, the patient presents with caries in various parts of the tooth, which should be used as the initial step to start axis preparation and shape changes as you proceed. Now I will discuss the limitation of insufficient axis cavity. Incomplete re-roofing causes a chance of leaving pulp in chamber and canals. Also, it will result in the failure of removing all coronal or necrotic tissue from the pulp chamber and canals. The second limitation is visualization, that causes the failure of proper instrumentation in the canals. The second drawback that comes with insufficient axis cavity preparation are perforations. That could be supragingival or subgingival crown perforation, or the perforation that exists or that happens in bifurcation area. The perforation that happens in the coronal portion, that is supragingival, it could be restored with a filling material, while that for the subgingival crown perforation, gingivectomy is performed to avoid impingement of gingiva on the biological width. For the bifurcation area perforation, GIC or MTA is applied. MTI is preferred because it's gold standard and its prognosis is very good. But for GIC there are some chances of micro leakage. I hope I might have helped you in understanding the very important initial step of RCT. If you have any query, do comment in the comment box. Thank you. Don't forget to like and subscribe to my video.